Hi there, my name is Raven, and I'm the host of Adventures in Nursing and Beyond. I'm a nurse who loves to help new nurses find their voice. You can find me most days scrolling Instagram for new recipes to try and helping my middle schooler conquer sixth grade math. But each week, I'll be popping into your ears to teach you how you can navigate your new nursing career and sharing behind the scenes on others who've done the same.
Hey, thanks for tuning in to another episode of Simply Raven Adventures in Nursing. In this week's episode, we're going to be discussing what it means to be an advocate. How does that play a role in you being a nurse? As a nurse myself and a parent of a child with special needs, most of my days are spent being an advocate for someone. What does that look like, you may ask, in the nursing world? Well, let's first start off with the definition of what an advocate it actually is. It is a person who pleads on someone else's behalf. As I started this journey many years ago, I had several lessons to learn, and one was that nursing is so much more than giving medication and following doctor's orders. If you are in it for the right reasons, then at some point you step into the role of being an advocate for the patients you care for. I've said it before and I'll say it again. Being a nurse, I'm the middleman between the doctor and the patient, the eyes and ears of the doctor, and the voice of the patient. With that being said, everything in patient care does not always align in a perfect, concise manner. I'm always team patient. I'm always rooting for the patient, meaning I want what's best for the patient and respect their choices regarding their care. My job is to provide them with the information regarding their care on a level that they can understand so they can make the most informed decision, as well as inform the doctor of any barriers or obstacles that may prevent healthy outcomes. Being an advocate means sometimes you rock the boat, you stand up and you have to make a little noise, so to speak, and other times it can be very gentle and comforting. I'm going to give you a few examples of what advocacy looks like in the nursing world. This first one is a very common situation that occurs. A patient cannot afford their medication. A lot of times when the doctor prescribes the medication, they're not aware of the cost or necessarily the patient's financial situation. You have a couple of options in this situation. You can bring it to the prescribing doctor's attention and try to get it changed to something more affordable. Even before reaching out to the physician, you may reach out to the pharmacy to see if there's a more affordable option available and have your list prepared. However, you have to be very careful with this one. The doctor may take offense and feel like you're overstepping and trying to prescribe. But I would have the list handy just in case. He would ask for recommendations. It also helps to know the temperament of the doctor before offering the suggestions. You don't want to step on the doctor's toes, and sometimes they're prescribing medication for an off-label use that you are not aware of. If the doctor insists and still wants the patient on this particular medication, then you still have some options available to you. You can ask the doctor if there's any samples that he may have in his office. You can reach out to the pharmaceutical company and ask them to provide meds to the patient at little or no cost. Most pharmaceutical companies have a department that handles these requests because of financial hardships. So whoever is the maker of the medication, you reach out to them and you can ask for it's a certain department that handles these requests. Sometimes you have to submit documentation proving your income. Sometimes it's just a couple of forms you have to fill out. And then pharmaceutical company will send the medications to the patient directly for 6 months to a year, and sometimes it requires a renewal. So that's one thing also you can do if a patient is having a hard time getting their medication. And then you can also refer your patient to the social services department of the facility where you're working at. Sometimes they know of other resources that may be available that we as nurses are not always privy to. So that's one example of when you're being an advocate for your patient. Another example of what advocacy looks like with your patient is, I remember this one particular situation where a patient is dying and her room is filled with a lot of family members. Some are familiar to me and some I've never seen before. And it was like a party was going on in there. The patient was no longer able to speak. She was nonverbal. She was restless. And the patient's family members wanted me to give her something to help calm her down. But yet at the same time, they were really asking a lot of insensitive questions as though she couldn't hear. How long is it going to be before she passes away? Do you think it's going to be tonight? Why are her feet so cold? Why are her feet turning blue? I'm like, hello, she can hear you. So, I have no problem with giving her something to relax. And they want to know why she's so restless. So being an advocate for the patient in this situation means telling the family in a gentle way that there's a lot of stimulation in here and y'all gotta go. Of course, the family is pissed. However, they are not my concern at that time. The patient's comfort and her being able to rest and be at peace. So that's another example of what advocacy looks like. Everybody needs their family around them, but also if it's affecting the patient, maybe not so many people in the room at one time. Maybe y'all can take a break and come back in, whatever the case may be. But we need the patient to rest and decrease her anxiety. Being an advocate also means not only your patients are going to like you or be happy with you, because you're doing what's best for them, and what's best for them, they may not always be in agreement with. Sometimes that means calling in other agencies, such as social services or elderly protection. This scenario can be very tricky. If you work in a facility, maybe having your social service department step in. But in any scenario, if you feel like abuse is being committed, you are under obligation to report that. Another example would be if a patient just doesn't look right or feel good. Their labs look good, you're taking their vital signs, everything looks normal within parameters, but they continue with persistence of complaints about, whatever's ailing them. And then you may have to call the doctor and just be persistent and be like, yes, I know these labs look good, or here are the results of the lab work you ordered or the test you ordered. This is what the vital signs show. However, my patient is still in pain or still has these complaints. Is there something else that we could do? I just have a feeling they don't look right. And then the last one that I have here is your patient is in pain. As an LPN working in the hospital setting, when I worked in the hospital, we were unable to give IV push medications. I worked on a medicine floor. We had a lot of patients that came in sickle cell crisis, and they had pain medication ordered every 2 hours IV push. And so the RNs on the unit had to give the medication. However, they were not always available. So instead of making your patient wait in pain, you can call the doctor and ask for an order to give something else, PO or IM, until the RN can give the IV push medications. This situation came up several times. And, you don't want your patient to sit there and be in pain waiting for someone else to come give medicine. So the IV push medication may be the drug of choice, what they prescribed, but hey, we're having a problem keeping the patient comfortable. Is there something that we can give in between or until they can get the IV push medication? These are just a few of the scenarios I have run across in my nursing career many times over. The main takeaway that I want you to know is that you have to find your voice so you can be the voice and use it to help your patients.
I hope you enjoyed this episode of Adventures in Nursing and Beyond. Make sure to rate and subscribe to the podcast so you never miss an episode. New episodes are dropping each week, and I can't wait for you to tune in. Until then, have an awesome week.